Region 8, this is Dr. Graham from the CDH EMS system. As you know, this month's topic is legal ramifications of your care. The driving point I tell all my medics is you document for several reasons, but most importantly is yourself. The unfortunate reality is this is a very litigious society, and any one of us could be a victim of that. So proper documentation, proper care, correct care is essential for your longevity as a medic in this world in 2015. In the following clips, we're going to give some examples of how you could be found liable through either a series of inadequate documentation, improper care, or a combination of the two. Please enjoy our feature presentation.
Another high-quality budget film of the CDH EMS system.
Medic Cowboy, in your own words, can you explain to me how you would perform a field pericardiocentesis?
Well, it's really quite simple. You take a little alcohol swab and a really big needle, about that long, and you shove it right under your ribs and you aim to the back.
What are the potential complications of that procedure?
I think you can impale the heart.
Explain the training you received to perform that procedure.
I really didn't get trained. I saw it once on a TV show and it looked really cool to do.
Medic Cowboy, can you explain to me what treatment you delivered to Mrs. Jones on January 1st, 2013?
I think Mrs. Jones, if I remember correctly, was in some respiratory distress and trouble breathing, so we went in her house and assessed her, and we put her on the cot, and we went to the hospital.
What is your standard of care for a patient in respiratory distress?
Well, generally we would assess her respiratory status clinically, and we would look for signs of distress like retractions and cyanosis and respiratory rate. And then we would put her on a heart monitor and an oxygen saturation monitor. And then if we found there was any abnormalities or the O2 stats were low, we'd hook her up to some oxygen. If we felt that her breathing issues were asthma related, we'd give her a breathing treatment. If it was due to CHF, we would either give her nitroglycerin if her blood pressure could handle it, or maybe a higher flow of oxygen and or a CPAP device.
None of that was done, so why did you not treat her accordingly?
Well,
what you just said.
Because quite frankly, when I walked in the house, I realized it was my ex-wife's mother, and I consider her the root of all evil.
Medic Cowboy, when you went to defibrillate Mr. Smith, who was in ventricular fibrillation, why didn't you perform that procedure?
Well, I went to charge the machine and I realized it wouldn't turn on.
And can you tell me why the life pack was not functioning?
No.
Whose duty is it to ensure that your equipment is functioning?
Mine. I'm supposed to.
Why did you not do that?
That's a good question. I guess I should have checked to make sure the machine was functioning before my shift started.
Yes, you should have. So, Medic Cowboy, you mentioned that you intubated the patient with no problems. Can you explain to me how you knew that you did?
Well, I got out all the appropriate equipment and I visualized the cords and I watched the tube pass through the cords, and then I verified through listening on both sides of her chest wall for breath sounds, and then we hooked it up to the CO2 monitor and looked for a capnography waveform, which showed that we had adequate waveform and were in the correct position.
And then here in your document, you only show that the ETT was placed, but no other information regarding verification. Why is that?
I plead the fifth.